My name's Neil Borley and I'm a consultant colorectal surgeon with an interest in Crohn's disease, and I work in Gloucestershire at Cheltenham General Hospital. Crohn's disease is an inflammation which can happen anywhere in the guts. Commonly, it tends to affect the middle part of the bowel, that's what's called the small bowel, the ileum, particularly just where it joins the large bowel in the region near the appendix. But the inflammation can happen anywhere, and it tends to cause the bowel to become thickened, swollen, inflamed and angry. Fortunately, Crohn's disease is relatively uncommon. It tends to affect mostly younger adults. Sometimes it begins to make itself known towards the end of teenage years, and the commonest age for people to be diagnosed is in their early 20s, sometimes early 30s. Crohn's disease can do many things to the bowel. The inflammation can cause different problems. The patients tend to find that they have a looser bowel habit, diarrhea, sometimes they lose a little bit of weight, generally feel poorly with that tummy pain, particularly when they eat. Unfortunately, sometimes the inflammation can get more serious than that and more significant, and the actual inflammation can cause abscess formation around the bowel, that's infection around the bowel, and indeed sometimes infection between two bits of bowel. Bits of bowel can end up getting stuck together. Sometimes when it's severe, the inflammation also causes scarring of the bowel, and the bowel can thicken and actually narrow down. Sometimes that doesn't cause much in the way of diarrhea, but patients get a lot of pain when they eat because there's a partial blockage and the food can't force its way through the narrow, thickened bit, what we call a stricture. Usually, if a general practitioner suspects someone might have Crohn's disease, there are several tests that we'd want to do. They will almost always do some blood tests which will check for signs of inflammation. Sometimes there might be a little bit of anemia, a low blood count, but usually there'll be hospital tests arranged, and they can be one of several different sorts of tests. A colonoscopy test is often very helpful. If we can see the area of inflammation where the small bowel and the large bowel join, we can take specimens, and sometimes that alone will enable us to diagnose the presence of Crohn's disease. Sometimes we need special x-rays of the bowel where fluid's drunk and the fluid goes down through the bowel and we can see if it's narrowed or inflamed. Sometimes a CT scan of the tummy can help if it's not clear or we're worried about areas of thickening or partial blockage of the bowel. CT scan is often very helpful for that. There's a range of different medical treatments. Some are tablets, some are suppositories or enemas if it's the tail end, the lower bowel that's inflamed, and sometimes it's injections, what we call infusions. Diet is important in patients with Crohn's disease. One of the most important things is making sure they have a healthy diet which is rich in protein and calories, particularly if they're having trouble eating or they've got weight loss because of inflammation in the tummy. It's very important simply to keep people healthy by having enough protein and calories. Equally, there are some special diets which actually help reduce the inflammation in the lining of the bowel, and they're usually prescribed by specialist dietitians working with the doctors who are looking after you, and they'll tell you exactly what it is, and sometimes those special diets come in packets and they actually physically help to reduce the inflammation. One of the features of Crohn's disease is it does have a habit of attacking different bits of the bowel, and it can come back in previously normal pieces of bowel even when it's either been removed at surgery or been successfully treated by medical treatment elsewhere. So it does tend to cause what we call a relapsing course, tends to come and go. Fortunately nowadays, the vast majority of operations for Crohn's disease can be done by keyhole surgery, so there's no need for large cuts in the tummy. One of the common questions patients who have Crohn's disease and might need an operation will ask is, will I need a stoma? That's a bag, the bowel brought out onto the tummy wall. Sometimes it is necessary in Crohn's disease. Usually it's a temporary measure. If the inflammation is very severe and there's infection around inside the tummy, if we remove a section of bowel, the two ends might not be healthy enough to join up then and there, so we have to bring them out onto the tummy wall. But it's very common that later on, when the inflammation has got better, we'll be able to get rid of the bag. It's very uncommon to need a permanent bag, particularly in the first operation. One of the important things about having an operation for Crohn's disease is the vast majority of patients feel much better after the operation. The reason for doing the surgery is to deal with problems related to the Crohn's disease complications, but they usually make patients feel very poorly, and even if they're on treatment such as steroids or other sorts of treatment, they often still feel very poorly. Once that bit of bowel's been removed or dealt with, patients often feel much better. They can get back to work, they have a much better social life, a much better sex life, and generally say they feel much better. So even though an operation may seem like a big step in Crohn's disease, most patients find that it usually gives them a much better quality of life afterwards.